Hello, welcome to my YouTube channel. My name is Tuta Aki and today we are going to discuss about varicose veins. This condition occurs when weak vein walls cannot withstand pressure, thus dilates with pooling of blood. Increased dilation causes valves to stretch and worsen the condition. Now let's talk about causes of varicose veins. It can be caused by vein wall defects, congenital defects, prolonged standing, pregnancy, obesity, aging, and systemic conditions. Now let's discuss about signs and symptoms of varicose veins. Dull aching pain, angioedema, feeling of fullness or heaviness, cramping, leg fatigue, bleeding with abrasion which is rarely, itching, dilated, twisting, discolored veins. Now let's talk about laboratory and diagnostic study of varicose veins. They can do Prodi Transletzbach which will evaluate valve competency. They can also do PET test which shows if deep venous system and communicating veins are competent. They can also do Doppler ultrasonography which will detect retrograde flow of blood in superficial veins with incompetent valves. Also they can do plethysmography which will reveal change in venous blood volume. They can also do phlebography or venography which will show abnormalities in the vein anatomy during various leg disorder. Now let's talk about treatments of varicose veins. They can do sclerotherapy, laser therapy, and if all treatments fails, the last resort they can do vein stripping. Next, let's discuss about nursing interventions. Apply anti-embolism stockings as ordered. Instruct patient to elevate the legs. Avoid constrictive clothes and pressure on legs. Now let's talk about patient teachings. Avoid anything that can increase pressure above the knees. Avoid crossing legs. Avoid a sitting chair that is too high. Avoid wearing gathers. Avoid wearing knee-high stockings. And don't confuse knee-high stocking with anti-embolism stockings. It's two different things. Wear anti-embolism stockings. Discuss importance of losing weight. Now let's talk about complications. If varicose vein left untreated, it can lead to bleeding, thrombophlebitis, DVT, pulmonary embolism, venous ulcers, and venous reflux disease. Thank you for watching my video. If you like it, please subscribe and share with your friends.